Okay, so we're gonna go over a basic introduction to the 3D for Medical app. I made a little presentation that Sarah's going to email out to all the AP1, AP2 instructors. The first part of this is a little horse before the cart or cart before the horse or something, but so when you log into the iPad, any of them, this is the icon you're looking for. Okay. And it does, we've been using this for several years, that does change by the year. Okay? I think when we first started using it was 17 or 18. So it will, you know, next year you pick it up, it's, I guess, be 21. So what we got last semester was we got 4 iPads that are for the 4 anatomy labs. Is that correct? Yes. Okay. All 4 of those, they're for that lab. They need to stay in the lab, like it says, and the access code is 121212. Okay, because they will, depending on how they're set up, they do time out. Okay, so unfortunately, that's one thing you may want to kind of look at. It's kind of frustrating when you're sitting there lecturing from it and it times out in the middle of your lecture and then you got to restart everything. So it might be something you kind of want to check out. So, okay. So how the students or how you guys get access to this, if you want your own access, we can check with the company and see about getting individual instructor access. You know, if it's something you want to do on your own iPad or at home. So when you go to the Apple App Store, I don't know about the other Android and stuff, but if you type in 3D4, so 3 and a D and a number 4, and then medical, and search, you're looking for this program. Okay. You know, unfortunately, I don't think it shows, but I think there's probably a couple hundred anatomy programs that pop up when you type this in. But this is the one that your student should be looking for, or you should be looking for.
What's it called?
Complete Anatomy Platform 2020. Yeah. Okay. Once you click on it, and this is more for the students, since we do have an agreement with them, but it's not set up through the bookstore yet. Once it's set up through the bookstore, they'll just be able to buy a code and they'll get access to it for the year. Okay? That's not set up yet. Hopefully for summer it'll be set up. If not, definitely for fall. But if they want to get access for it now, once they log in, this is their best option. They get the Student Plus license. So it's $35 for, I think they get like a year access, and that gives them access to everything in the program. All the courses, everything else. Okay? Pretty much unlimited access to everything. Okay. So program not required for class, but highly suggested. Will be required by fall, if not sooner. Yeah, and we were actually told yesterday that maybe that's not I guess there's problems with optional material.
I did put it on shells, so there's a link, and all the Blackboard shells, they can go in there and click on it and go straight to them.
Oh, okay.
Yeah,
All right.
so.
As long as because I feel like sometimes the first day they're like,
Yep.
Yeah.
And usually there's a 3D for medical.
And yeah. Yeah, and if you want to take this and make a picture of it or whatever and put it in like the PowerPoint for the first day for everybody, I mean that's.
You want me to change this a little? I can upload everything.
Yeah. So.
okay.
Okay.
They've already, I don't know if people have started looking at
So anyway, I wouldn't spend a lot of time on this, but there it is. You know, it's not required for them, but yeah. Okay. So once we get past all that and you get into the program, this is what you see, what you should see, and this has changed a little bit. The 2 main things you should be focusing on here, and there's other options, but the 2 really main things to get started and the 2 basic things that we'll be utilizing as a basic platform are the courses and or the models. Okay. a lot of this other stuff has to do with teaching aspects of the program and setting up our own program and things like that. So, you can definitely play with them, but and see what they are and what they do. But but those are the two. So, courses and then models. So I put that there. Okay. Courses. The main course that fits our course. So when you go into courses, and I'll show you this. I'll pull it up. Is actually the human. Here it is. So the reason I put this is there's undergraduate human anatomy regional, and there's undergraduate human anatomy system. Okay, we teach by system. Regional anatomy literally would go over the head, and it would go over all the structures in and on the head. And then they move to the neck and the shoulder and the chest, and by region. And you go over every anatomical structure in that area at that time. We don't teach that way. I mean, there's nothing wrong with it. We just don't do that. So this is the one you want to look for. Okay. The course that's already set up here, like I put, there's 42 pre-recorded lectures, and I guess they're kind of along the lines of like a TED Talk or something. I don't know. I'm not really familiar with all that, but they're actually very short. Most of them are 2, 3, maybe 4 minutes long. So they cover an entire topic in very short intervals. Okay, and they can go through the entire. There's 20 to 25 hours of material there. Okay, so this is what you see. So here's the undergrad human anatomy systemic. Okay, here's the other one was right here. It's the regional. And once you go into this, you'll see everything from cardiovascular anatomy to orthopedics to, there's a course on here on KT tape, athletic tape, how you actually apply it for different injuries around the body. There's all kinds of stuff, courses people have made. So.
And we are eventually going to make our own.
Yeah. So this, where we're hoping this will progress is IRSC for our AP1 lab, our AP2 lab. We will be making our specific course that will follow our lab book for our 2 semester course. So once we get that finished, the students will log into this area and they'll see IRSC, Human Anatomy, AP1, which that'd be kind of cool, if nothing else.
I saw that email that you
Yeah.
sent.
So, okay. So when you get into the course, this is what you're going to see, and I'll pull it up on the actual program. The big thing here, and most of you full-time, I guess, 2 adjuncts. One of our concerns with this course thing here is having the instructor just stand up here and click play and playing a bunch of videos for their students and saying, okay, you're on your own. Okay, that's not what we want to do. So we want to keep away from that. What I really envision, and everybody can use this in their own way, but I envision this as a supplement. I've gone over anatomical positions, planes, terminology. I point this out to the students. Rob pointed out the other day that maybe at the end of lab, when everything's kind of wound down, people have gone over everything, that you could say, okay, hey, let's do a little bit of review, and you play the video then. And they might pick it up a different way. Everybody teaches a little bit different. You pick up different things different ways. The other thing I really imagine these being useful for is at-home study for the students. Okay, again, they're very short attention span, short video. Okay, so there's pretty much introduction to everything, and then it goes into details for each little system. Okay, so on to models. So the other option, if we come back up here, models. Okay, so what I've gotten is the full body model here, the male full body model. They're adding options to this all the time. The big thing here to kind of view is at the bottom here, you get each body system as a tab. Okay. So here's a quick tab to go back to models. If I want to switch and go back to something else, I can click on that. Skeletal, if everything else, I'll point this out here. Again, this is kind of the cart before the horse, but each one of these has an on or off button. So if they're all 100% on, this is what you get. And I can peel away the skin layers. I can peel away the connective tissue layers. Then I'll see the muscular layers. I can peel those away, and I'll start seeing the cardiovascular layers, lymphatic. I can peel those away, and I'll start seeing nervous system. Or you can turn all those off and just pull up the nervous system. I mean, you can do it pretty much in any combination you want. Let's say you want to show the nerves in the body and the arteries. I can go into nervous, turn it on, go into arteries, turn them on, and that's all it shows. So it's kind of just, this part's kind of up to your imagination and how you want to teach with it. So really what you're focusing on here, this is what I'm talking about with turning on or off. When I click on the system, I get a plus or a minus. Yeah, I'm going to. Yep, okay. So this goes through, so here I click the minus, and what happened? I lost the skin. Okay. Here I click the plus, and it changed the skin to a dermatome model. Okay. It's not a different layer, but it's a different perspective. Okay. The other big place you'll see this, and I'll show you this in more detail, is with the bones. When you have the skeletal system up, doing the plus and minus doesn't change the number of bones. What it does is it changes the perspective of what we're looking at on the bones. So one might show origin and insertion of the muscles. One might show processes and condyles and foramen and stuff, and it'll highlight those. Okay, so it's just kind of a matter of going through plus and minus with each system and figuring out what that shows you. So, okay, so here's the skeleton, just basic everyday skeleton. If I click the plus, this is the anatomical model that shows origins and insertions for the muscles. And then when I go in here, I can actually click on each one of these, and it will tell me what the origin or insertion for the muscle is, which is nice. Okay. For muscles, this is really nice. I mean, not everybody's an exercise physiologist or physical therapist or chiropractor. A lot of people have not had biomechanics courses and kinesiology courses, so you may not be 100% up on all the muscles. So this is really nice because when I come through, let's say I've got my textbook open. I open it up to, I don't know, where are the muscles? Okay. Say I open it up to muscles of the thorax. Okay. Levator scapulae. I'm like, oh crap, I don't remember what that does. Well, I can take this model, and I'll show you this again in a second. I can spin it around. I can find the levator scapulae. Or if you're having a really senior moment and you can't remember where the levator scapulae is whatsoever, you can go up and you can actually search for it, and it'll find it for you. Okay. So, instead of having the model and you're like, oh crap, you get down to the leg or the arm and you're like, oh crap, I don't remember exactly which muscle was where. Or you don't remember in the leg the posterior tibialis. There's several muscles there, and the exact one is kind of elusive. So on here, that gives you a really good, it reinforces your teaching. Is the way I kind of look at it. Because we don't all know everything about all this.
Before you switch, the motion tab
Yeah.
is really useful because if you click on it, it actually demonstrates the action of the muscle for you, which is half their practical most of the time. You have to ask them to identify a muscle, and then a lot of times you're asking them for their action.
So I'll show you that on the tab here.
It's really small, but it's the third one.
When I click on the pectoralis major here, it gives me my stuff here. It gives me origin, insertion, actions, nerve supply, arterial supply. So it lists all that right here.
Which they have to fill out in
Yep.
their lab manuals as part of their homework. So if they're like, where do I go?
Yep.
You can tell them their lecture textbook, you can tell them the internet, or you can point them to here and say,
It's all right
everything
there.
you need is right there for your lab manual.
And if I come over here, the third tab over is motion. So if I click on that, it will, so like the pectoralis major, it's got 6 or 7 actual separate actions, depending on how you utilize it. And this will show those different actions, and it actually has animations that go along with each one. Not all the muscles have motions. A majority of the major ones do. So, okay. So,
They ask their stabilized.
yeah. So the last little thing here is, and again, this is just kind of an introduction. Last little thing is tools over here. You've got a set of tools for labeling. You know, I could go through and I could click label, I can do text box, there's a pin. So you could, you know, if you like to kind of doodle on pictures as you're presenting, you can do that. Cutting tools, there's actually a cutting and a dissection tool. So if I've got the complete anatomy model up there, I can click on that and I can literally dissect layer by layer with one of these tools. Growth tools, I really haven't played with those much, but with like bone, you can click on a certain amount of the bone or an organ, tissue, and you can click growth and you can actually see what happens to it, which is kind of cool. And it's definitely more clinical than what we're really dealing with, but it is a cool tool. And then there's a bunch of other stuff down here with tools, but I think that kind of, okay. And the last thing for this is there's a YouTube channel that the company set up, if I can get into it. Maybe. There we go. Okay. So it's got here, this is a whole new series that they just added on cranial nerves. Complete anatomy, it's more of a descriptive thing. This is more for students, how they can utilize this to pass your anatomy exams. This is more for teachers, inspire and motivate your students. Let me know if you find something that works. Educate your patients. That was one of the big things this was originally developed for, was patient education. You know, your patient comes in and they have orthopedic issues or cancer issues or whatever. You know, you can actually pull the model up and show them, instead of the little chart on the wall that really doesn't show you anything, that nobody ever uses anyway. Procedures, defibrillators, bucket handle tears, filling occlusions, yeah, all kinds of stuff. Pathologies. So anyway, I think that's a good resource for the instructors and for the students. So you might want to just kind of point that out to them. Okay. So any questions on any of that? Okay. Okay.
So say that instructor is working on something like this, and do they have ability to save it?
There is. It's a little more advanced.
Okay.
Yeah, we can.
So if they wanted to do something with this, they would have to like write out some steps so that they can.
Yeah, we'll have to kind of. All the iPads right now are under Chris's account.
Right.
So anything that gets saved to it gets saved to his account.
I did notice all those are on different pages though, doing different stuff, and it's letting us do that, which is cool.
Yeah.
So all that, so to your text, the apps are all independent, and all the access code, or all my email address and the password does is just give you the full access to all the tools and all that kind of stuff. They're all independent, it's just allowing access.
Yeah. But yes, there is a way to, you can actually record what you're doing. And so there are, yeah, but that's definitely more.
All of that stuff too, if you want to take screenshots, if you wanted to pull the model on your desktop, so you can go to 3D4Med, log in on your desktop, download the app. I don't know if you can download it. to your desktop or not.
There used to be a PC version. I don't know if there is now. Yeah.
But you can go to the website, you can use this at home if you want to build a PowerPoint and use these images, and you can save those images. So you can label a bunch of different things and save them.
Okay. Yeah. Okay. So we can do something with that or write something up about how to do that. So okay. So what you do, one of the downfalls to this, and it may be, I don't think at any of the campuses it's going to be any different. Some of the lecture rooms at Pruitt could be different because you have 2 independent access screens. The problem here is we're limited to looking at one device at a time on these systems. So if I have my PowerPoint pulled up, I can't look at this at the same time. So unfortunately, that's kind of a technology issue that we're going to have to just kind of deal with. So you just kind of have to think about that to implement this with your teaching. So I come in here and it's an Apple iPad. I click on Apple TV on the screen or on the control panel. You got to know, you have to know what room you're in, because that's going to be the Wi-Fi that is it Wi-Fi or Bluetooth? Wi-Fi, okay. So I come in and I don't know if you can see this, but I come here, screen mirroring, Apple in 205. I click on that, and now my iPad is up on the screen. So it should just be that simple.
Nina, are you teaching at Chastain? It'll be like C211 instead.
Yeah.
It's got the same little box, it's just,
Yeah.
don't look for N
Oh.
because there's no N building down there, you know, there's
The
no
Apple
buildings.
TV will tell you the name. So Steve pointed out that in the bottom right-hand corner on the screen when he pulled up Apple TV, it said the name of that Apple TV that you're
Yep.
now looking for on your device.
Yep.
That's the one you want to select.
Okay.
The other thing is if this is the first time you've connected to that Apple TV, it'll prompt for a code. So it'll prompt a code onto the display, and then you actually have to take that display and type it in on your iPad or device.
Yeah.
Other than that, it's all.
It's reasonably idiot-proof. I mean, there have been days in lecture that something gets a little weird, and I go to log in. I'm like, oh crap, I can't log in. Chris, come help. He comes in and clicks on it, it comes right up. So it should be pretty easy. Every once in a while, it's not. So I don't know what to. Okay, so there's my icon right there. Click on it. Okay.
I found out too that not all classrooms are set up with Apple TV.
Yes.
So you gotta, don't go in expecting to use this if you haven't checked out whether you can actually use it.
All the labs are, but if you're wanting to use it for lecture, that's another issue we'll have to deal with. So here you go. So here's the courses I talked about. So if I click on courses, here's what's currently in there. 12 lead interpretation. There's actually a whole thing on cadavers, cardiothoracic dissection, cardiovascular surgery, clinical heart, emergency medicine, trauma, free lectures. This is new. This histology. So I don't know. I haven't played with that yet. I don't know. You might want to look at it, see how you could implement it in the class. Might be useful. But if you go all the way down, here's the courses here. So if I click on it, it brings up each. It's literally got. Let's say, I mean, joints are not everybody's favorite lecture or subject. Okay, well, yeah. Yeah, so, that's an option. I mean, you could even, as an instructor, you could go through these prior to it to kind of beef up your own knowledge, not just for the students. So, you go down and, we go into the muscles, blood vessels. It goes through the whole body, okay? So again, my vision of that is this more as a supplement for the students to use at home, for you guys to beef up on your anatomy knowledge, self-study.
But in the future, are you thinking that you're going to be?
In the future, hopefully we will have something very similar to this that will follow our lab book exactly. But still, even in that case, even once we do have that, we don't necessarily want the instructor standing up here pushing play and teaching from our pre-recorded course. I mean,
I'm thinking if people were able to do things and create things and be able to save them.
yeah,
Even if there was a way to actually save your name, we could build the library this semester as people teach it.
yeah,
Start from scratch.
yeah, definitely. Yeah. So, again, sharing videos, content. So I go over here to models. So here's the current options. They're doing a lot more of the microanatomy. So you can go in and do the microanatomy of the kidney, bone cross-section. There's a lot of, and a really good thing about this is we don't have models for all this. There's a lot of stuff on here that we don't have models for. We can't show the students besides just showing them a picture. So this is a really good, you can show them in ways that you can't do it with models. So, okay. Let's just go to full body. Okay, so is everybody logged into this point? Okay, so let's just look around. So skeleton, we'll just look here. Okay, so there's origin insertions. If I come up here, click on that one. That's the insertion, temporalis muscle. Okay. And then if I wanted to, I can come in here and I can show the muscle, the nerves. It'll do all kinds of stuff with it. It's just a matter.
Isolate the muscle.
Yeah, you can isolate. I can come in here. Well, I can't from there. I don't have it turned on, but okay. So then if I back up, I got a different set of highlights. So let's see what that is. Deltoid tuberosity. Okay, that's one of our structures in the lab book. You're not sure exactly where the deltoid tuberosity is? There it is. The thing to really make note of is you don't see that structure in the other screens. You have to be in the appropriate screen. And especially with the bone. With bone, there's 6 or 7 different screens that show different bone structures. So unfortunately, with all the bone things, they're not all where you think they should be. Yes?
So you're just pressing skeletal and then plus, or what are you doing to get to that?
Okay, so right now I'm clicking minus. Okay. So everything's off. I click on skeleton and all I see is a plus. I click it once, that's all I see is just a basic skeleton. I can find the deltoid tuberosity here, but when I click on it, all it's going to show me is the humerus. It's not going to allow me to click on specific bone structures. Okay, now you guys all know where the humerus is. And you've read all this and you know what it is, what it does, why, all that stuff. Now you're like, well, where's this? So I can come over here, I click plus. Now, all of a sudden, I get lesser and greater trochlea. Tubercles, sorry. Okay, been a long Christmas, yeah. Okay, so there's the lesser and there's the greater. Okay. And since we've already pointed this out, here's the deltoid tuberosity. In this screen, it is not highlighted. you cannot show it to your students. So I'd have to go back here to skeleton, click the plus again, and it's taking me to another screen.
And the names of those screens I just figured out are right above the word skeletal at the bottom. It's like in
Yeah, when you click on it,
you can see it really
yeah.
well on your phone, but you can't see it well.
Okay, so this is showing different surfaces of the bone. If I come in here and click on it again, now I can show you the deltoid tuberosity. Or I can come down here to the elbow and I can show you the capitulum and the trochlea. Okay. Yeah, and your fosses. Okay. But, you know, especially the bone's the biggest one that has the most multiple screens. So as the instructor, what you kind of need to do if you're going to utilize this to teach from, you need to go through and learn what's on each screen. And which screen you kind of need to click on to see which structures. Unfortunately, they're not all where you think they should be. Probably the worst thing for you to do is for the very first time you've played with this, stand up here and try to teach these structures to your students. And you're like, well, wait, I can't find it. And you're clicking through screens and clicking through screens, and finally you decide it's not there. So yeah, you maybe as a prep for the course, go through and find the structures that you're going to be teaching if that's what you're going to do with it.
If you do find yourself in that situation,
You can search.
search for it.
Yep, I can come over here, search. Where'd search go? Something happened. Why did that come up? Okay, here's a good example of a issue. I have no idea why that popped up and it's on half my screen. So my best what I would do here is I would get out of it and immediately restart it instead of sitting there screwing around with it, trying to figure out how to fix it. Make it, I think yeah, but that side screen was still there.
Worked on mine. I looked up like tuberosity.
Yeah.
Like, just use the term tuberosity and it brings up all your different.
Yeah,
tuberosities.
okay, so here.
Very specific because there's multiple.
Oh, so I did that, and when I logged back in, if you saw that it popped down, would you like to restore your previous session? So you're like, oh my God, I'm into this really complex anatomy thing, and now it's all locked up, and what am I going to do now? Well, you exit out of it, you log back in, and it gives you the option to go back to where you were, which is nice. So, so I just type in troch.
And that helps too. There is the little speaker.
Yep.
that
So there's
pronounces
all.
for you in case you're like, 'cause I do that all the time. I'm like, I pronounce it this way. Let's see how it's really pronounced.
We haven't found a lot of this, but for example, Jim found last semester that the conduction system.
Oh, yeah.
Yeah. The conduction system of the heart, they had it listed under the nervous system. And you're like, well, what's wrong with that? Yeah, if that's what you're thinking right now, please keep your mouth shut. The conduction system of the heart is not nervous system tissue. If that's news to you, you might want to go look that up. It's specialized heart cells.
We sort of illustrated
So,
it and made it look like nerve.
yeah.
In the heart.
And then when you actually searched, for it, it popped up under the nervous system heading.
Did they fix it?
Yes. Well, I think they did.
I think they did, yeah.
Yeah. So let's just look.
Yeah, I was gonna say, let me look that up real quick.
Oh, no.
I was gonna say, no, there's still.
There you go. Sinoatrial node, nervous system. It is not part of the nervous system. I don't care what you were taught or what your book tells you, it is not. Yeah. So anyway, there's the search. Okay. So one really cool thing I like to do with this is one thing that I've been teaching for, I've been teaching it, but not in a productive way. When I talk about the muscles, one big thing that I talk about is hip issues. And I actually have the students get up and I have them walk around the room and I have them watch each other's feet. And inevitably, you're going to have somebody whose legs, their foot's turned way out. They're externally rotated. So what I do is I come in here and I turn on the muscles. And I find the butt. Okay, so most of your, excuse the general term, your butt muscles, a majority of them are external rotators. They rotate the leg out. Okay, they're very short, strong muscles. So in a lot of people, these muscles are really tight and really strong, and when they don't stretch them, don't have the proper flexibility, they can tend to turn the foot out abnormally. Okay, so I can show that. The next thing is there's a condition called Piriformis Syndrome, which you maybe heard of, maybe haven't. Okay, or another term called sciatica. So if I come in here, gluteus maximus tells me all about it, tells me all about the butt muscle. I can hide it. And there is the piriformis. Nasty little muscle. Anybody know why it's such a bad muscle?
It's really hard to stretch.
It's hard to stretch. Anybody know what runs right underneath it? Or sometimes can run through it? Well, come over here, click on Nervous System tab, click.
And that's my surgery.
Yeah.
It would have been good to bring this in and be like, hey guys, we're gonna.
Right there that is your largest peripheral nerve in your body. It's about the size of your thumb. And in some lucky people, it can actually go through some of the fibers of the piriformis muscle. So there's very few models that you can actually show that on. I mean, you can show the piriformis muscle, you can show the sciatic nerve, but it's really hard to show them together. But then, I mean, you can come through here and I can hide the piriformis, and you can actually see the nerve now and where it runs. And then I can come in, and if I want to get more complicated, I can come in, I can click on the nerve, and it gives me all the information about the nerve. So it's, I've been teaching anatomy for 30 years. I taught my first AP course when I was 19. Actually 31 years now. Jesus.
You had a birthday.
I had a birthday. Yeah. When we go to Russia during summer, I take the iPad with me, and I play with this, and I learn things. I'm picking up stuff that I'm like, wait, that's where that is? So, I play with this on my own, and I'm picking up stuff after 30 years of teaching this that I'm like, wait, now that makes sense. So it's a cool program. I mean, it's definitely in-depth. It does a lot of stuff, and that's kind of the downside to it. It's a benefit to it, but it's also a downside. I mean, you can get in over your head really quick with it. But it's also an incredible teaching tool. I mean, you can't do this with human dissection. Once I've removed the skin and the connective tissue off my cadaver, I can't come back in and add all the fascia back.
It's really hard to rotate a cadaver.
And once you've removed all that crap, the fat, you don't want to put it back. I guess you could dig it back out of the trash can and reattach it. But yeah, and the other thing, like Jim just said, I mean, you can't, that's virtually impossible to do with your cadaver. You can rotate them, but it's, yeah. Yeah. So, anyway, that's,
Why don't you show them a couple of the tools?
okay, tools. Let's come over here to tools, label. So let me get rid of some of this nasty connective tissue. Okay, so let's maybe go in here to the neck muscles.
So the muscles kind of layer on as you hit the plus?
Yep. Yep. Yeah, they'll start at the very basic muscles, the deep muscles, and work your way out to the superficial muscles. So that's another cool option. I mean, you're talking about superficial, middle, or deep muscles. You can't show that on a model, really. So,
The pumping heart is really cool that you can take
yeah.
pictures off of.
Yeah.
That's a new feature that you can stop it.
Yeah, that was
I
how.
just added that.
That's really
And
cool.
that was the thing,
So let
remember,
me-
Steve, they had the nerves that were,
Yeah.
they're not there anymore.
So let me get rid of
The
that.
nervous system with the beating heart.
Okay, so there's sternocleidomastoid. If I want to come in, I can't actually click on label, and I can put a label in here. So, yeah, if we get into this a little bit more and you work on basically recording a lecture from it, you could go through the page or pages in the textbook for each individual set of muscles, and you could literally make up your own little thing. There's sternocleidomastoid. Trapezius, orbicularis oris, orbicularis oculi. So you can go through and literally label all the muscles that your students are responsible for. And then you could actually record this. But that's, again, a whole nother thing. If I just want to come in here, I can draw.
No, you can pull this up on your phone, but you don't get the tool.
Right.
I figured out.
Yeah, the phone is actually pretty limited on what you can do with it.
You can view a lot
Yeah.
of it.
Cut, let's see what cut does.
Oh, it cuts it away so you can see underneath.
Cuts it in the-
Oh, there you go.
That's pretty cool. I've never used that. So here's the pectoralis minor. Cut.
You can add pain to it.
You have to click on wherever that little,
Oh, wait.
Yeah. So that's pretty cool. That's an option I haven't used. Pain. Let's see what pain does.
Oh, jeez.
I
How is that supposed to?
draw on the model to apply pain. Yeah, that one may be a little hokey. I don't know.
What's
Growth.
throbbing whole body?
If you apply pain to the cut, like if you cut there,
Oh,
I don't know,
yeah.
Yeah, I make a,
pretty big cut.
yeah. So,
Cut that pectoralis major, you're big.
if I just want to look at the thorax.
Oh, I think I get it. So if you're talking about maybe if you're experiencing pain in this, you can make a region.
Yeah.
Like what could be happening, like to what organ? I think that's what it's just an animation. It's not like, hey, there's pain, because you could say, oh, if I have pain in my near my clavicle, what could it be? I don't know, broken clavicle. Who knows? But
So there's the chest that's empty. One thing I don't know, I've done this before. I don't remember how to delete. There's a way to delete.
Can you hit the undo button up there?
Yeah, but it goes through like in order what you've done and what you haven't done. But anyway, if I come in here, you can see that it's a chest. There's nothing there. Well, nothing. So turn off beating heart.
Whenever you're on the tool, at the top left in that teal kind of box, it says delete all. If it's a text box that you want to delete, you can delete all of them that way.
Okay, so like pin. Oh, clear. There we go. Cool. Got it. Okay, so now we got a heart in there. We can come in. Intercostals, we can hide those. There's your internal intercostals. There's your innermost intercostals. Okay. So there's pericardium. You can hide the pericardium. There's the parietal pericardium. You can hide that. Yeah. Adipose tissue.
It also looks like if you hold the button down on undo, you can scroll to where you
Oh,
want it to.
okay.
Like if you want to delete like half of what you
Yep.
did.
So there's, I want to see the valve, the heart. So when your AV, here.
Now, if you double tap on the heart now, will it actually see it function?
Um,
You turn the beating heart back on.
Should double tap.
here. There's tricuspid valve opening and closing, which we definitely can't do with any of our models. Here's this pulmonary semilunar valve opening and closing. So, anyway, that's, I can sit here and play with stuff all day long. But that's pretty much, that's kind of the bottom line with it is it's something you got to play with and get used to using.